Hi everyone, my name is Ian Peake and I'm a third-year medical student at the OUTU School of Community Medicine in Tulsa, Oklahoma. And I'm joined here today by two of my great friends and colleagues at the medical school in Oklahoma City.
Hi, my name is Christen Jarshaw. I'm a second-year medical student.
My name is Lauren Oliver. I'm a first-year medical student.
And we're here today to talk about the Reproductive Health Symposium, which was a student-led and student-planned and run conference that took place this past December. And specifically, we wanted to talk about some of the interdisciplinary approaches that we took in planning and designing the sessions for the conference, and see how that could further help students explore medical education as well as benefit patients in the future. So as I mentioned, this was a student-organized conference. We had a bunch of student groups working together during the age of COVID, all stuck at home, trying to find ways to best supplement our education in line with our interests. We had these groups, all that focus primarily on providing better care toward underrepresented in medicine, both from a trainee and patient perspective, as well as increasing access to reproductive health care from a family planning, contraception, pregnancy education standpoint for patients and for future providers as well. So this slide is our money slide. It's talking about the interdisciplinary framework that we tried to use in designing the sessions for the conference. We took a very broad approach to the definition of interdisciplinary. We wanted to incorporate as many perspectives and branches of knowledge as possible in approaching the topic of reproductive health. And so specifically, we really wanted to hear first-person voices and experiences from Black and Indigenous people of color, as well as LGBTQIA, sexual and gender minority groups from a provider's perspective, as well as a patient perspective in our sessions. We wanted to further explore family planning and contraceptive training beyond the context of what we typically learn about as a health professional student in Oklahoma, and also kind of explore some of the social factors that come into play, namely religion, when patients and providers are making reproductive health care decisions. In the age of COVID, Zoom has become the big conferencing tool, and we definitely leverage that extremely well to increase the attendees that are coming from all different geographic backgrounds. And we wanted to try to draw in as many professions as possible outside of medicine, so physician assisting, nursing, public health, social work, as well as other academic colleagues to the conference. So this slide just kind of reiterates some of the goals and the objectives that we have. Feel free to review this in our slide set after our presentation.
We were very excited to pull over 120 students from around the United States. These students came from many different schools. You can see which states these students were from, highlighted in green on the map on the right. We also were able to pull a variety of conference speakers, including several different medical specialties. Those are listed down below. We also had members of the community that were of different sexual backgrounds and religious backgrounds, including Christian, Islamic, and Jewish community leaders. This provides an overview of our session. As Ian stated, we really tried to hit on topics that weren't covered in traditional medical curriculum, including abortion, LGBTQ care, breastfeeding disparities, and some of the racial disparities that we see. Our keynote speaker was Dr. Saisha Dennis from the OU Tulsa School of Community Medicine. She presented a PowerPoint entitled Health Disparities and Need for Reproductive Justice in Healthcare, where she really discussed the history of racism, slavery to Jim Crow era to now, specifically focusing on maternal and infant mortality and how that has changed throughout the years. She also highlighted actions that healthcare professionals can take to address these inequities to hopefully close that gap in the future. This was a slide from her presentation that I really liked because it goes to show that there are several factors beyond the individual that impact our healthcare, including many different factors in the community around us. This details some of our breakout sessions. Our first session was about the language and inclusive practices that we need to encompass when we talk about approaching contraception in teenagers identifying as LGBTQ. Our second session addressed PEP education in the LGBTQ community, as well as others who might be predisposed to HIV. Our third session centered around providing abortion in Oklahoma, and we had a provider who trained in California, New York, and came to Oklahoma, currently works here providing abortions, and he discussed some of his experiences based off of the geographical location regarding the safety and the patient care experience. We also had physicians come in and talk about second trimester abortion. They are currently training in Kansas, but they're going to move to California to provide abortion care there. Our fifth session was about breastfeeding disparities, and it really talked about how racial and socioeconomic barriers can impact pre and postnatal care in both mom and infant. This session talked about how one bad office visit can really set a negative tone for the rest of the healthcare experience of the mom and the child. So very important that we create an office culture that is inclusive and open to everybody. This is a slide from that breastfeeding session. We can see that Oklahoma ranks 48th overall in the health of women and children. We have some strengths, including low drinking in women, low cost of infant child care, and low prevalence of homeless family households. But there are some challenges that we need to address and overcome, including the amount of uninsured women, the amount of people who smoke, and the adverse childhood experiences that can impact the overall healthcare of a child as it grows up. So our sixth session was about providing better care for intersex patients. We had an intersex individual from the community come in and share their personal testimony regarding their experiences in the healthcare system and how we can make that experience better for other intersex people in the future. Our seventh session was about underrepresented minority providers. We know that Black, Indigenous, and people of color are underrepresented in both the physician role and other roles in healthcare. And so they wanted to talk about the impact of the bias and discrimination that they have seen, as well as how we can start to address that issue in the future. Our eighth session included a transgender patient panel, and they talked about some of the issues that they have encountered and offered their perspective. And our ninth panel was a faith and reproductive choice panel. As you can see in this picture, we had a variety of different backgrounds. We had Christian, Islamic, and Judaism represented, and it was very special because we know that abortion has a lot of factors that go into it, and these leaders talked about how they were able to provide counsel with their congregation regarding reproductive health care decisions, specifically abortion.
So our symposium broadly touched on each of the IPEC competencies. Values and ethics were probably hit on most between all of the sessions. Many of our speakers focused on the real duty we have to provide affirming reproductive care to all of our patients, seeing it as kind of the root of all of our health practices. In addition, the faith and choice panel really provided us some nuanced views on our traditional values and ethics. Otherwise, our sessions focused on how a collaborative and inclusive office culture is really the key to promoting patient autonomy. So this was our first pass through the Reproductive Health Symposium. We certainly learned a lot and have identified many areas for improvement. One of the most important areas to better engage students from other colleges earlier on, particularly by utilizing the college representatives in the IEP office. We would also like to pull students across campus sooner to really get a better understanding on where the gaps they see in their education and their programs are. We would also like to include more perspectives from disabled patients and the geriatric population. These groups are often left out of reproductive and sexual health conversations, including some trauma-informed care components would be really integral in furthering the goals of the symposium. Trauma is unfortunately really common, and this sort of education would be applicable to really any health specialty. Providing more opportunities through these topics would give OTs, PTs, social work students, nursing, and even more opportunities to explore their roles in our clinical settings and to really better advocate for all of our patients in a positive reproductive care setting. Thanks to all of these groups that helped support us and make the symposium happen, whether through resources or through providing us speakers. And thank you for listening to our reflection on the symposium.